Yes. See, this is our title. The title is to evaluate the effect of insulin in rabbits at different time of intervals. Okay. So this that insulin is not new for you. Almost every one of you have heard of this insulin, and you might have seen this uh, with the diabetic patient. Okay, this is used by the diabetic patient. So here we want to see the effect of insulin in rabbit. So this is a very basic experiment. Okay, this is the basics for the research work. So in this, everybody knows that whenever we are giving insulin, so there will be decrease in the blood glucose level. Okay, so with the help of this experiment, we are going to study the different. We are going to study the principle and the exact procedure. Okay, what is the scientific procedure of estimating the hypoglycemic effect of insulin? Okay, now come to the requirement. So the first requirement is rabbit. Okay, almost the weight should be 1.8 to 2.2 kg. Then in case of drug, we should have insulin preparation, then normal saline preparation. Okay, then phenol red, then 14 to 18% of the glycerin. Okay. Now come to the principle. See, basically insulin is a hormone, okay, which is produced by the beta cell of the pancreas. So basically it is produced by the pancreas, okay, and it's a hormone, okay, and it is secreted in response to high blood glucose level. Okay, it is secreted from pancreas in high blood glucose level. Whenever the blood glucose level is high, so there will be release of insulin. Okay, this is blood glucose level and this is insulin. Okay, so insulin will try to reduce this increased level. Now a released insulin act on the insulin receptor, okay, on the body cell. You just imagine, for example, this is the body cell, okay, and this is insulin receptor. So insulin is binding to this receptor, okay, it is binding to this receptor and then activates the glucose transport. So this is, for example, transporter of the glucose, and this is your glucose molecule. So the glucose molecule will enter into the cell. Okay, once again I'm repeating, this is insulin receptor, this is insulin, and this is your body cell, and this is glucose transporter. Okay, once the insulin is binding to the receptor, so this channel gets open and then there will be entry of glucose into the cell. Okay, so by this mechanism we can reduce the blood glucose level. We can reduce the blood glucose level. Okay, so this is the main role of insulin. Then apart from this, reduce blood glucose level, inhibit insulin release. Now opposite of this, okay, जैसे now this is achieved. Okay, ये situation आ गई हमारे पास. Now the blood glucose level is reduced. Okay, now just imagine blood glucose level is reduced. Okay, so in this case, the cells of pancreas will release glucagon. Okay, now there will be release of glucagon, and this glucagon will increase the blood glucose level. Okay, how it is increasing? By two mechanisms, by glycogenolysis. Okay, glycogenolysis means glycogen is converting to glucose. Okay. Hello. Yes, any problem? Okay. So glycogenolysis is conversion of glycogen to glucose, and then second one is gluconeogenesis, means formation of glucose. Okay. So in both the cases, the glucose level is increased. In both the cases, glucose level is getting increased. So this is the mechanism of action of glucagon. It works whenever there is a reduction in glucose level. Okay, so what we have learned in this slide, we have started with the insulin, which is a hormone secreted by the pancreas through beta cell. Okay, so insulin is released in case of hyperglycemia. Okay, in case of hyperglycemia, whenever the blood glucose is high, okay, so insulin is getting released, and then insulin is binding to the receptor, and then there will be movement of glucose from blood to cell, and hence the blood glucose level is now reduced. Now in another situation, whenever the blood glucose level is low, so glucagon will release, okay, and it will increase the lysis of glycogen to glucose, and it will form the glucose. So there will be increase in the blood glucose level. Okay, so insulin and glucagon, so both are having opposite effect. Insulin is decreasing the blood glucose level, and glucagon is increasing the blood glucose level. Yes, is that clear to all? Roll number 3.
Yes, sir.
Okay.
Yes.
Roll number 20. Yes, roll number 20. 20, are you with me? Roll number 21.
Yes, sir.
Sir, yes, sir.
Okay. So
Roll
this
number
is
20, yes, sir.
yes. Okay, fine. So this is principle of the experiment. Now come to the procedure. Okay, see, this is diagrammatic representation. See, this is mechanism of action of insulin. Now you can see this complete is your cell. Okay, body cell. This is the insulin receptor, and this is insulin. So insulin is like a key. Okay, and this is glucose channel. Okay, transporter of the glucose, and this is glucose. Okay, glucose molecules are there. Okay, now see, whenever there is binding of key with the receptor or binding of the insulin with the receptor, then there will be release of the, then there will be opening of this channel. Okay, opening of this channel, and the glucose is getting entered into the cell. Okay, so by this mechanism, the blood glucose level is going to reduce. Now see the different mechanism, different actions. Okay, now see, in increase in circulating glucose. So now the pancreas is detecting this response. Okay, the glucose level is now increased. Now insulin is released from the pancreas, and this insulin is increasing glucose uptake by skeletal muscle. Okay, glucose uptake means the glucose will be absorbed by the muscles, skeletal muscles. Okay, so by this mechanism, the blood glucose is reduced. Okay, second, in adipose tissue, again there will be increase in glucose uptake. Increase in glucose uptake means increase in glucose absorption. Okay, third one is decrease glucose output. Okay, so the output will be decreased. Output means synthesis of glucose from liver. So by these three mechanisms, in all these three mechanisms, the blood glucose is going to reduce. Okay, so this is what the mechanism of insulin is. Now come to the procedure. See, what you
Sir.
have to do is you have to select the
Sir.
healthy rabbits first. Okay, and the weight should be in between 1.8 to 3.2 kg. Then you have to, the animal should be maintained in uniform diet for 7 days. Okay, you have to maintain a uniform diet just to avoid the error. Okay, ऐसा नहीं होना चाहिए कि किसी को ज्यादा आप दे रहे हो, किसी को कम दे रहे हो. यूनिफॉर्म डाइट पे रखो सो दैट द एरर्स कैन बी minimized. Then you have to fast the animal for 18 hours. You have to fast the animal for 18 hours with no access to water. Okay. Then you have to select 3 animal and inject 1 unit per ml insulin. Okay, you have to inject the animal, inject the insulin to him, and prepare the drug solution in freshly before the administration. Weigh 20 unit of insulin accurately and dissolve in normal saline. Acidify the solution by using HCl and pH. So all these points are related to preparation of the solution. Okay, preparation of the solution. Then you have to prepare it freshly. Then you have to dissolve in normal saline, and then you have to maintain the pH 2.5 by adding the hydrochloric acid. Okay, just a second, just a hold on, hold on. Yes. So we were discussing the procedure. Then in procedure, in preparation of solution, you have to add 0.5 ml of phenol. Okay, and then 14% of glycerin just as a preservative. Okay, and then you have to make this solution 20 unit per ml. Okay, then you have to withdraw the this blood volume. Okay, you have to withdraw the blood from marginal ear vein. Okay, जैसे ये ear है. Okay, so from ear you have to take the veins are there. Okay, so from this vein you have to take the blood, right? So this is called as marginal ear vein withdrawal, blood withdrawal. Okay, then you have to estimate the blood glucose level, right? So this is called as initial blood glucose level. So I can show you. Say this is observation table. So initial blood glucose level is without insulin. Okay, this is 136, 139. Okay, 139, then 142, and the average is 139.55. Okay, similarly, then what you have to do is, then you have to inject the insulin to the animal and check out the blood glucose level up to 5 hours at the interval of 1 hour each. Now you can see, okay, here I have given the insulin injection, and then after 1 hour I am taking out the blood. Okay, after 2 hour I am taking out the blood, after 3 hour, 4 hour, and after 5 hours. Okay, for second animal also see the same response. Okay, same. So the minimum reduction in blood glucose level is at 2 hours. Okay, and after that there will be increase. So you can plot this graph like this. Okay, this is 1 hour, 2 hour, 3 hour, 4 hour, and 5 hour. Okay, so this is your blood glucose level. Okay, this may be 50, then this may be 100, this may be 150. Okay, 150. So you will find that, see, you have to take average of all at 1 hour. average is 125. At 2 hour, the average is 80.70. Okay, and at 3 hour, this is 90.93. So like that, averages are there. Then you can plot this average. Like first one is this one. Okay, second one is 78 is at this point. Then again 90. Okay, then 115 and then 113. So you can come, the graph will come like this. Okay, so the maximum effect is observed at 2 o'clock. Okay, at 2 hour, not 2 o'clock, at 2 hour, there will be maximum reduction in blood glucose level. Is that clear? Procedure? Yes, anyone?
Yes, sir, clear.
Okay, the procedure is very simple. आपको करना क्या है, सबसे पहले एनिमल लेना है, एनिमल को फास्टिंग पे रखना है, उसके बाद आप इनिशियल ब्लड ग्लूकोज ले लोगे, ठीक है, उसके बाद आप क्या करोगे, इंसुलिन दोगे, और एट इंटरवल ऑफ 1 hour, 1 hour के बाद ब्लड ग्लूकोज लोगे, 2 hour, 3 hour, 4 hour एंड 5 hour. ओके, तो ये हो गया आपका एक एनिमल का. देन सेकेंड एनिमल, okay, then third animal, and then finally you have to take average. Okay, and then you have to plot the graph. That's it. Okay, so the conclusion is mean percentage decrease of blood glucose level at different time interval determines the effect of insulin. So there is decrease in blood glucose level which determines the hypoglycemic effect of insulin. Okay.
Yes, sir.
So this is the experiment. Now we can use this concept for research purpose. Okay, we can prepare groups like group 1. This is normal control. Then group 2. This is insulin. And group 3 is your test drug. Okay, test drug. Okay, और रीडिंग वही लेना है. सबसे पहले इनिशियल लोगे आप, देन 1 hour, 2 hour, 3 hour, 4 hour and 5 hour. Okay, then inject this to 3 animal, 1, 2, 3. Okay, तो ये इसका एक टेबल हो जाएगा. Then for insulin again you can take 1, 2, 3. Okay, ये एक ग्रुप हो जाएगा. Then again you can take 1, 2, 3 for test. Okay, तो यहाँ पर आपको एक एवरेज मिल जाएगा, यहाँ पर एक एवरेज मिलेगा, देन यहाँ पर एक एवरेज मिलेगा. Okay, then you can compare the effect. So this is a research protocol. Okay, so this is your experiment. If you have any doubt, you can share with me. Okay, so I'll forward this PowerPoint to you. You just go through it. Okay, after some time, after a few days, I'm going to give you this one assignment. Okay, so you can solve the assignment, right?
Okay, sir.